Good day, you speaking to Dr. P. Bihari. I've been a dentist since 2007. I'm a general dentist and we are now into fast braces. I was first in Goble Road and then I moved to 63 8th Avenue in Morningside, Durban. We try and make dentistry different for our patients, something that is totally unique. You can come sit down, have a cup of tea. You can relax in the waiting room listening to some peaceful music. You can relax on our massage chair. And to make the dental experience so much more calming, we use topical anesthetic for most of our procedures, which helps to numb the gum and take away that pain and anxiety associated with dental treatment. Right. I want to tell you a little story. When we were young, we used to get together with our cousins, run about and play. That was the most exciting times in our lives. And how often we used to come up with the most exciting and innovative games. We used to play until late, until supper time. We were so exhausted mentally and physically that we had no energy to brush our teeth. And that happened to me as well. And that was the start of it, the drama, the bone loss, the gaps between our teeth that started appearing as we get older. And I have one of those annoying gaps. And we find ourselves going to the dentist, asking them to fill this hole between our teeth. Now, the poor dentist, he is trying to look everywhere to find this hole in our teeth, while the hole is between our teeth, those annoying gaps. The dentist can fill the tooth, but they can't fill the bone that has lost or receded between your teeth. And with those, you have to take care of them. You have to floss regularly. You have to remove the plaque, bacteria, and food between your teeth, or those are eventually going to grow and annoy you, so that when you're eating food, it all gets stuck in there. And that's one of the most annoying things. So I came up with a strategy. I'm going to visit the dentist every 6 months. I'm going to brush twice a day and make sure I brush before I get tired. And I tell the kids that come to us, make sure that after you eat, that you brush your teeth. Just make sure. And flossing is so important to remove the plaque and the debris or little food particles that the toothbrush could not remove. And then I came up with some important tips along the years that I would like to share with you. Just a few tips about brushing your teeth and the reason to come to the dentist. Okay, what's important is to brush your teeth with a gentle manner in circular motions and not as if you're scrubbing your teeth with a hard toothbrush. You must try and hold your toothbrush at a 45-degree angle and gently brush your teeth. This prevents gingival recession or recession of the gums. Make sure you brush both the front and the back of your teeth. Don't use a toothbrush where the bristles are too hard. These will damage your teeth. Dentists recommend using a toothbrush with soft bristles. It's important to brush your teeth twice a day. Not once, but twice a day, and for at least 2 minutes. You can use aids like an hourglass or play a song, and that helps you to brush for the whole 2 minutes. It's also important that you leave 30 minutes after eating and then brush your teeth. When you're brushing your teeth, it's good to start in different areas all the time. If you brush your teeth and start in the same area all the time, what can happen is you could cause too much of pressure in that one area. Another thing is, if you walk around the house and brush your teeth, you forget about how long you are taking to brush your teeth and you over-concentrate in certain areas of your mouth. And that can cause gingival recession or damage to the enamel by brushing too hard. Another thing is, don't forget to brush your tongue. You could use a tongue scraper, and you could apply some toothpaste and brush your tongue, because your tongue also harbors plaque and bacteria. It is also important to change your toothbrush every 3 months, because the bristles get frayed, and if you brush with that type of a toothbrush, it can damage your gums and your teeth, and that's not good at all. Try and use a pea-sized amount of toothpaste. Sometimes we are overzealous and we want to use the most amount of toothpaste, and while a pea-sized amount of a fluoridated toothpaste is what is recommended. The cherry on the top is to floss. Make sure you floss to remove those tiny bits of food stuck in between your teeth. Sometimes it's not very tiny, quite big chunks of food can come out between your teeth. Make sure you floss your teeth to remove the food, the plaque, and the bacteria that can accumulate there and cause bone loss and damage to the bone and the gums. Eventually, we don't want to end up with loss of our teeth. Some other tips are: try and avoid smoking. Smoking can cause all sorts of cancer, bone loss, and your teeth can become loose, and it can cause staining of your teeth. We also notice that those patients who overly consume alcohol, increased consumption of alcohol is directly related to bone loss. We've definitely seen that. We also advise patients who are diabetic to come in regularly to have their teeth cleaned. In diabetes, we've noticed that the gums become so puffy and red puffy, and often we see a diabetic patient just coming in and they need to just remove their tooth. We can't find any cavities on the tooth and we need to remove it. It's really sad. All right. And I just wanted to tell you just a little case studies. I had a patient who came to me. She had puffy, bleeding gums and mouth odor. And her husband wasn't happy. She wasn't happy. Emotionally, it wasn't good for her. We used topical anesthetic to do her cleaning in most instances. In those areas that were difficult, we had to inject. We try to be as gentle and as calm as possible when we are doing the cleaning. We advised her to come every 3 months to do her cleaning, which she did do. And she kept up with brushing twice a day, flossing, using the mouthwash, and cleaning her toothbrush. And what we noticed, just after 4 visits of coming at intervals of 3 months, we noticed a tremendous decrease in the bleeding of her gums, a decrease in the amount of blood that accumulated at night on her pillow. Can you believe that? And as I told you, she kept up with her flossing, her mouthwash, her regular cleanings, and her mouth odor decreased. She didn't want to lose her teeth like her mom did, and she was really motivated to do this. And what we noticed, her teeth stopped getting looser over time and they stabilized. It prevented her teeth from getting more loose. She was a happy overall patient. Another case study, we had a young little girl come in who was teased at school because she had crooked teeth. That was not good at all. Her self-esteem was low and she was overwhelmed. It's not nice to feel like that amongst your peers. We introduced her to fast braces. As we were talking about fast braces earlier, fast braces helps to straighten your teeth at a far quicker rate than normal braces. There's far less pressure on your teeth. You use one wire and you don't have to remove teeth. That's a very good added advantage to prevent anxiety in kids. You don't have to remove your teeth. And now she's walking and running around just like a normal kid. And that took us 11 months to a year to complete. Absolutely amazing. So guys, I hope you have learned a lot from our little chat. And don't forget to subscribe and hit the like button. Thanks a lot for all your participation. We're super excited that you were here listening to us. Goodbye. Take care.